We'll have Dr. Samuel Adekola in the course of the program. But let's move on now. Nigeria's healthcare system faces a lot of problems that date back to many years. It is not only poor or inadequate infrastructure that ails the sector. Poor remuneration for workers, gross underfunding, inadequate medical personnel, further compounded by the migration of health workers abroad, shortage of drugs, are some of the problems that the health system is faced with. Now, the struggle for what is due to them has put resident doctors and the federal government on a warpath for more than 20 days since the association embarked on an indefinite strike. So far, all the meetings brokered between the government and the association have not yielded an agreeable resolution. Public health expert Dr. Mebawondu joins me now to have this conversation. Good morning. Thank you for joining us on TVC Breakfast. Now, let's look at the situation between resident doctors and the federal government. If you look at the papers this morning, the resident doctors are saying that they can't trust the government. And though the federal government had, taken them to the industrial court, which the government is now saying it is settling out of court, an MOU was signed with the Nigeria Medical Association, not the resident doctors now, but the medical association. And the medical association is saying that the resident doctors rather are saying that they are going ahead with the strike, even though the federal government is saying that it will start implementing the MOU beginning today. Now, when you look at the back and forth, one would have thought that when we had the outbreak of COVID-19, we would have learned a lot of lessons to addressing the needs of not just the medical practitioners, but, the situation around the health sector. But we see a situation like this. What do you make of this whole situation?
Obviously, the present health system we have in the country is not working. Now, the greatest pointer to that is this fact that when you see the leadership, the president, the governors, the lawmakers of a country, and even the top businessmen of a country not patronizing the health system, note that health system is not going to work.
The minister, Lai Mohammed, said that the president is not, using the system doesn't mean that the health system is not at the state it should be, basically saying it in that light.
You saw a governor who completed so-called, one of the biggest hospitals, had a simple injury and flew abroad. Listen, there's no trust in the health system. You see, because there's no reason, medical record can be transferred. Supposing the doctor treating the president abroad passes on, are you now saying that the health will not continue? We know the health system in such a way that you can transfer information to another doctor who can pick up and run. Let's get it right. As long as the leadership of a country is not patronizing the health system, as long as the business leadership are not patronizing the health system, there won't be confidence in that health system. Even when you are on strike, they don't reckon with you. They're not concerned because as far as they are concerned, they have their own health system elsewhere. Now, so that is the greatest, of course, indicator that this health system, which of course we inherited from the colonial system, is not working. Between, how many years now? Like independence and now we've had about four health reforms, okay, in such a way that they met the traditional health system in Nigeria, and then we moved on to the British people came and put on us a unitary health system. And then until 1988, when we now had to look at the concrete health system and say that this is what we hope to do, Alma Ata then helped us and said we're focusing on primary health. Even that primary health we're focusing on, and which should be the right thing to do, people are not utilizing it because we made the primary health care system so irrelevant, so weak, so well unfunded, no fund for it, and people are not utilizing that to the extent that people are now moving to the secondary and tertiary health system. The referral system is not there. The connection to the locality or community is not there, and this health system, this primary health system, 30,000 all over the country, less than 20% are functioning.
Absolutely.
Less than 20%. So now we need to sit down and rethink the present health system we're operating. It is not working for us, obviously. And that's why you see that when something is not working for you, you see all this kind of strife, underfunding, nobody is concerned about it, you know. Big bad here and there, you know, distrust will be magnified. It's not working.
So if we are to rethink the health system as it is, where do we begin? Because we recall that at some point, I think in 2017, the federal government said it was going to renovate a majority of the primary healthcare centers, about 10,000 of them at the time. But like you rightly pointed out, only about 6,000 of them are functional as it is across the 36 states plus the federal capital territory. I mean, if we really want to do this, where do we begin? Again,
you see, we're running health in silos, okay? Now, if you look at the whole health system of Nigeria, because let's not just look at health as the biology of health. The biology of health has to want to do measurable ones where we can do tests and see that your organ is functioning. But there are, apart from the organ or cell, there's self, me, okay? All my organs might be functioning, and I may have a mental problem.
Right.
Despite the fact that I have a good organ. And then there's a society where somebody is having 20 children, putting challenges on and put other pressures on the health system. So if you want to look at the whole health system, that means that we have to even look at how do we incorporate the traditional, the spiritual, and the orthodox health system into the whole system.
Interesting.
And this is how it's going to go. Simply put, we look at it at the local level, at the primary healthcare level. Everybody must be linked to a primary healthcare system. Everybody in the country. And that's quite simple. You are in your local government. You know that you are linked to a primary healthcare system. And if you have to get referral, you know, if any traditional person treating anybody must be linked to a health system in that community. In such a way that if you're treating anybody and needs referral to the general hospital, it's very easy for a doctor to transfer your document to the general hospital. This is what I've done so far. In such a way that when you're treated for that general hospital, you can now come back, okay, and then continue your treatment locally until we find a way to have a link, because everybody is rushing to the secondary and tertiary health system, and there's a lot of load in that area. And then secondly, you have to look at the 5 knobs of healthcare reforms.
Quickly.
Financing is key. How do we move money into the health system? And then how do we disburse that money? Payment system is very key. The governance and leadership in health system, and that is the greatest issue, because, you know, health is just like a multi-layered structure.
Right.
That everybody needs to, you know, there must be a leader that drives that something. So leadership is not just me having a health degree. It's not just me being a doctor, but what is the add-on things that then makes me a better doctor to manage health system. So now, and if you look at the political leadership, they abandon you. Nobody is talking about it. And then regulation. Now, how is the payment system? What laws govern this health system? You know, and then, you know, the connections. The 5 knobs must actually be looked at and, you know, tuned in such a way that we get what we want from the health system. But as it is now, this health, what we are running now is not working. The earlier we agree, the better.
All right, let's leave the conversation there now. Public health expert, Dr. Mebawondu, thank you so much for your time on the program.
My pleasure always.